Continuing our study of chronic obstructive lung diseases, this short video will introduce asthma. Asthma is classified as a chronic obstructive lung disease, but unlike emphysema, chronic bronchitis, and bronchiectasis, asthma is intermittent with sporadic attacks, and it does not typically destroy lung tissue. Between asthma attacks, many patients will demonstrate normal lung function and have no complaints of difficulty breathing. It is not uncommon for some patients with asthma to have a persistent level of airway inflammation and a cough. Where the primary cause of emphysema, chronic bronchitis, and bronchiectasis is the use of tobacco products, the most common cause of asthma is allergies. An asthma attack will result in bronchoconstriction, or narrowing of the bronchi and bronchioles caused by constriction of the smooth muscles that wrap around the tube-like structures. An attack includes an increase in airway inflammation that you can see in the picture here that reduces the inner lumen of the bronchiole. There may also be tightening of the smooth muscle that wraps around the bronchioles, and this further constricts the inner lumen of the bronchiole, making airflow more difficult. The anatomical changes result in frequent coughing and wheezing that may often be heard without the aid of a stethoscope. Unlike emphysema, chronic bronchitis, and bronchiectasis, where there is tissue destruction, asthma has a degree of reversibility with bronchodilator medications. Asthma may be seen alone, or it may occur in conjunction with other chronic obstructive lung diseases. Just a few fast facts about asthma. Statistics from the Centers for Disease Control and Prevention tell us that 1 in 13 Americans will have asthma. In children, that number is about 1 in 12. That totals about 25 million asthmatic patients to be treated when needed and educated to self-manage for an improved quality of life. With a smaller airway diameter, the patients that we see in the hospital emergency room or as inpatients in the hospital are most commonly children. Statistically, more boys than girls will develop asthma as children. In the adult population, women more often than men will be diagnosed with asthma, and women will be more likely to die than men. For the adults, we'll see that adults are 4 times more likely to die from asthma than children during an attack. Although we know much more about treating asthma, diagnosing asthma, controlling asthma, every day we'll see an average of 10 Americans die of an asthma attack. There's no cure for asthma. It is, however, treatable, and the goal becomes prevention of attacks and management of symptoms so that patients may enjoy a reasonable quality of life. Some cases will be more severe and more difficult to manage. As a respiratory therapist, it's important that you understand the disease and the treatment in order to best serve your patients and their families. Asthma is expensive in a number of ways. It is the leading chronic illness in children and the number one cause of missed school days. Because it is children with trouble breathing, each of those 13.8 million missed school days leads to a similar number of caregivers who must be off work. Rare is the daycare provider who says, "Sure, bring me your wheezy blue child. Be happy to have them at my house." Asthma medications, physician office visits, ER visits, and hospitalizations add up to almost $82 billion per year. Asthma can have a significant impact on quality of life factors. Avoiding triggers often means avoiding leisure activities and some sports. A trip to the mall past the Bath and Body Works may be a trigger for some. There can be no family dog or cat because my brother, my sister, my mom, dad, somebody in the family has asthma. The day's plans often carry the unspoken, "We will go, we will do," if your asthma's okay. There's no cure for asthma. However, there are a number of medications now available to control the underlying inflammation and control the constriction of the bronchial smooth muscles. Diagnosis of asthma requires attention to patient history. How do you feel now? What brought you in? When did it start? What were you doing when it started? What have you eaten? Has this ever happened to you before? What were you doing then? What have you tried to make it better? What has worked? What didn't work? Pulmonary function testing is a primary diagnostic tool for asthma. Often a patient with intermittent asthma attacks will have minimal to no symptoms on the scheduled date for pulmonary function testing. Administration of aerosolized methacholine may be used to stimulate an asthma-like reaction. Post-pulmonary function tests, the patient will then be given a medication to reverse the attack that was caused by the administration of the methacholine. As an obstructive lung disease, the ability to exhale is compromised. For patients with asthma, daily use of the peak flow meter to measure peak expiratory flow rate may be a useful tool. Routine use on good days allows the establishment of the patient's own personal best. That number can then be used as a baseline normal for that patient. It's more useful than comparing the patient's everyday values to the normal values based on patients that have no lung disease. As you complete the readings and videos in the unit, you will be learning about the many medications now available for the treatment of acute asthma attacks and to control persistent asthma symptoms. The fast-acting medications have a quick onset to action of 3 to 5 minutes and a relatively short duration of only 3 to 4 hours. Long-acting medications have a longer onset to action of up to an hour, but a much longer duration of 12 to 24 hours. Confusing them can lead to serious, even deadly outcomes. A few medications are available in multiple formulations. Others will only be available as a solution, or as a metered dose inhaler, or as a dry powder inhaler. Each one of them has different technique for proper administration. Many of the MDIs and DPIs will have a proprietary administration device. For that reason, you will want to watch the manufacturer instructional videos in the links on Cobra. Asthma treatment is largely based on the frequency and severity of symptoms. The GINA guidelines developed by the Global Initiative for Asthma provide a 5-step plan for advancing medication interventions based on the level of control of symptoms needed. Page 214 in the clinical manifestations text includes a very useful chart of the guidelines. As you complete the study of asthma, read the text, read the online link to articles, visit the website links. There is a draft chapter outline if you find that an outline helps for study purposes. Complete the practice ungraded quiz to assess your retention and the questions at the back of the chapter in the text.